So the veins of the thorax, they are having the two groups. One is called the anterior group and another is the posterior group. Anterior group, they are called the vena comitants. And the posterior group is called azygos venous system. As we have done the anterior part first, the first rib, the inner border and the scalene tubercle, the costal cartilage, forms the joined with this manubrium sterni, sternochondral junction. So this is the anterior group of the venous system of the thoracic cage of the thoracic cavity. Second rib, this is the third. As we already know, the artery which supplies the intercostal spaces is the branch of the subclavian artery, lying in the groove behind the scalene tubercle, and the branch of the first part of subclavian artery. So it runs in front, and in each intercostal space divided into superior and the inferior anterior intercostal artery. So wherever the arteries are going, veins coming from that area, having the same name, anterior intercostal veins. So all these anterior intercostal veins, they drain into a vertical vein lying parallel to the internal thoracic artery. On both the sides bilaterally, all these veins which are intercostal, anterior intercostal veins, they ultimately unite to form two vena comitants and whole of their impure blood from the anterior half of the thoracic cavity or the intercostal space is drained. As these are the vertical veins and they accompany the regional arteries, so they are called the vena comitants. As the blood, venous blood is going opposite the gravity, pulsations in the artery, it helps the venous drainage in the anti-gravity manner. So this is the reason why these veins, they are accompanying the artery. So they facilitate the emptying of the venous blood ultimately because of the pulsations transmitted to the veins. So wherever there is the anti-gravity in the lower limb, you will again see, because the lower limb is very long, and here also every artery accompanies the veins, or veins, they are accompanying the big arteries of the lower limb. Again, blood has to be pushed against the gravity in the lower limb, and pulsations of the arteries, they help in their drainage. It may be big artery like the femoral artery accompanying the femoral vein, which is single. But there are veins of the leg. They are double. They are vena comitants, accompanying the, particularly the lowermost part of the human body in the standing posture of Homo sapiens. That is the problem is anti-gravity. So in order to minimize the stagnation of the venous blood in the various regions of the body, this system of the vena comitants is there. So main action is the, or main function is the vena comitant is the proper drainage. Otherwise the stagnation of the blood is very common in the legs. So its clinical aspect is that stagnation of the vein, venous blood in a chronic patients which are admitted in the hospitals for months or years together because of some illness. Maybe he or she may be in coma, or there may be hemiplegia, half of the body is paralyzed. So in these cases, there are chances that it lead to the venous thrombosis in the veins, and this is called the stagnation. And lead to the condition that is called the DVT. So DVT is the clinical aspect of the venous stagnation, particularly in the lower limbs. In the chronic ill patients which are hospitalized or at home quarantine, that is called the distal vein thrombosis. So distal veins are the veins of the leg. The patient is lying in the supine position. The blood cannot, venous blood through the veins, it cannot reach the inferior vena cava and in the right atrium. So because of the inaction of the muscles, the veins, venous blood will stagnate, and stagnation will lead to the thrombosis. And the thrombosis may lead to the obstruction to the outflow of the blood, and this will lead ultimately to the bleeding spots on the leg, skin. They are visible on the skin. Because stagnated blood ultimately will come out of the vessel wall of the veins, and patient may present with the petechial hemorrhage or the spots of the pinkish or red or magenta color spots on the skin of the leg. They are the signs of the DVT. So such chronic patient, in order to avoid the DVT, the physician, they recommend the tight stockings. The tight stockings on the leg and the foot end of the bed is raised for the gravity drainage. So these are the measures taken for the patient lying in the supine position in the hospital. The foot end of the bed is also raised 15 degree or 20 degree, and this will help the gravity drainage and prevent the DVT. These clotted, thrombosed venous blood will enter into the circulation and it will obstruct any of the veins of the human body. That may lead to the multiple organ failure. The venous drainage will be obstructed. So in order to prevent this complication, in the chronically ill patients lying in the bed, we recommend the tight stockings which will collapse the peripheral or the superficial veins. And the deep veins, because they are accompanying the arteries, they are vena comitants. The arterial pulsations will be transmitted to the accompanying veins and blood will ripple. It cannot stagnate, it will always in a flow and it will prevent the subsequent thrombosis. So in the leg veins, we recommend tight stockings so that whole of the peripheral blood should be shifted into the deep vena comitants and their proper drainage to the heart is possible. So that is the purpose. That is the reason why we put the stockings. So this is the anterior system. All the vena comitants, right and left, accompany the internal thoracic artery, ultimately reach into the above the first rib, in the root of the neck, and here we know in front of the scaly tubercle on the superior surface of the rib, who is waiting?
Subclavian vein.
The subclavian vein is waiting because it lies in front and the artery lies behind. So they ultimately, these vena comitants, they will drain into the right and left subclavian vein. So that is the proper drainage. If you know already the venous system from plus 1 and plus 2, there is the internal jugular vein. This internal jugular vein is bringing the impure blood from the brain and ultimately combined with the subclavian vein. And both unite to form what is called the brachiocephalic vein. Brachiocephalic, not cephalic. It's a wrong pronunciation. From plus 1, plus 2, you don't know. The teachers, they don't know what is cephalic and what is cephalic. It is brachiocephalic. Cephalic means related to the head. Cephal, Greek word. So this forms the right brachiocephalic vein. Similarly, on the left side, the left internal jugular vein, it meets with the left subclavian vein to form the left brachiocephalic vein. Right and left, both brachiocephalic veins ultimately unite to form the superior vena cava. Two vena cava are there, superior and the inferior. Superior vena cava brings the impure blood from the upper half of the body. If you know what is the definition of the superior vena cava. So superior vena cava is made for the venous drainage of the upper half of the body and the inferior vena cava for the lower half. Lower half of the body includes lower limb and the abdomen only. Lower limb and abdomen only, and the upper half of the body venous drainage means venous blood from the brain, number 1. Number 2, venous drainage of the blood from the head and neck. Number 3, impure blood from the upper limb. And 4th, impure blood from the thorax. So they constitute the upper half of the impure blood. And whole of this blood is pooled in the superior vena cava. So see how superior vena cava is formed by the union of the right and left brachiocephalic vein. And these veins, the left brachiocephalic vein, because the superior vena cava has to open into the right atrium, and the right atrium lies in the right side of the heart. So left brachiocephalic vein is longer because it has to come on the right side to form the superior vena cava. So this is how the right brachiocephalic vein and the left they unite to form superior vena cava, which opens into the right atrium after piercing the fibrous pericardium on the right side of the midline of the body. So that is the venous system. Now comes, this was the anterior group of the venous system. Now we'll switch on to the posterior group of the, or what is called the azygos venous system. So anterior venous drainage we have done along with the upright anatomy, that is the DVT. Now we'll do the azygos venous system. The word azygos means having no pair, alone, unpaired. Again the Greek word. I have told you that anatomy is nothing but the collection of the 3,500 odd words. So this word is also azygos. You are listening for the first time in the life, and you have to remember whole of your life. That is most important. So venous drainage, this is the posterior group. And when we see the posterior part of the thoracic cavity, what we see here, there lies the thoracic inlet with the T1 vertebra articulating with the first rib, forming the thoracic inlet. And all the other vertebra, T2, T3, 4, 5, 6, 7, 8, 9, 10, 11 and 12 is the last thoracic vertebra. The last floating rib is 12th. Then the lumbar vertebra of the abdomen start L1, L2, L3, L4 and so on. So the last vein of the intercostal vein belongs to the last rib. And the vein relation of the last rib is called the subcostal. A special word we are using for the 12th rib is the subcostal. Sub means below, costal means the ribs. Last rib is the 12th. So it is called the subcostal. Subcostal vein, subcostal artery and subcostal nerve. T12. So this subcostal vein, similarly, posteriorly, the first posterior intercostal vein lies in front of the neck of the first rib. Remember the formula SWAN. In the SWAN, the V stand for first posterior intercostal vein. So this is the posterior intercostal vein here. First posterior intercostal. And first posterior intercostal vein on right and left side, both of them. We open into the brachiocephalic veins. First posterior intercostal vein, they open both on right and left side into the right and the left brachiocephalic, because that is nearby. Then the vein from the second, the third and the fourth veins, they all unite together. second, third, and fourth. So this diagram is very, very important. Everybody should make it the full page diagram because it needs practice for 1 to 10 to 12 times. Then it will be solved. The question may be asked broad label or it may be asked like the write a short note. So everybody should draw in a full page. So second number is very important because the first, the second, third and fourth. Second, third and fourth on the right side and left side the drainage is different. First, second and third, and fourth on the right side, left side, they unite to open into the